All right. Hello, everybody. My name is Kyle Trecarton. I'm the Chief Medical Officer at BI-Plymouth. I want to welcome everyone to our hospital today, and also thank everyone for attending on this really exciting day when we're highlighting our mobile integrated health program, which is an amazing collaboration between the hospital, Brewster Ambulance, and especially Plymouth County for their unwavering support. First, a little bit of explanation of what mobile integrated health is. This is a program that can be designed in slightly different ways, but at the crux, it's about meeting patients where they are to deliver needed care, even outside of the hospital setting. So the BI-Plymouth program is delivered by Brewster Ambulance, where specially trained paramedics visit patients in their home to deliver needed care to keep them from having to return to the hospital after a recent hospitalization. They can deliver care such as IV medications, can obtain labs right in the comfort of the patient's own home, do dressing changes, assessments, and then the paramedic actually calls one of our physician assistants or physicians to obtain medical advice over the phone. Through this program, we've been able to substantially reduce the percentage of patients that have to be readmitted to the hospital, even amongst the very high-risk patients that we select for this program. So again, I want to thank Brewster Ambulance for being, a wonderful partner in this program for many years, for having paramedics that are so well trained that we can trust them to take excellent care of our patients. And next, I wanted to introduce and welcome Sandra Wright, the Plymouth County Commission Chair, and thank the county for their really generous gift, which is helping to fund this program, because as she'll go into a little bit, currently this is a program that's not reimbursed by medical insurance. So thank you.
Thank you so much.
Yeah.
Pleasure to be here.
Thank you.
Good morning, everyone. Thank you for joining us today. My name is Sandra Wright. I am the chair of the Plymouth County Commissioners here on behalf of my colleagues Greg Hanley and Jared Valenzola. It is a pleasure to welcome all of you as we come together to highlight a program that represents the very best of what can happen with local government, healthcare providers, and community partners working together as a common goal. I want to recognize several people whose leadership and partnership have helped the County Commissioner Mobile Integrated Health Program grow into the success it is today. I want to acknowledge Dr. Kyle Trecarton, and Jen Burrell at Beth Israel Deaconess Hospital, Plymouth, John Chen of MassCon Medical, Mark Brewster and Chris DeBona of Brewster Ambulance Service, Rich McKinnon from PFFM, and finally our County Treasurer Tom O'Brien, whose support at the county level has helped strengthen this effort. Programs like this are built through collaboration, persistent and shared understanding that improving counting community health requires new approaches, and we are grateful for the commitment each of them have shown in helping move together and forward. Mobile integrated health is an important example of how we can think different about delivering care and support to residents, especially those who may need help navigating complex health challenges before those situations become emergencies. By bringing services directly to the community, this program helps improve outcomes for patients, reduces strain on emergency departments, and strengthens the connection between healthcare and public safety. As a county commissioner, we have a simple mission. We believe that our member community deserves leadership defined by strength, decisive action, and measurable results. We're always looking for ways to support effort and improve the quality of life across Plymouth County, and mobile integrated health reflects that commitment. It is practical, compassionate, and designed to meet real needs in our community. Its a record of accomplishments speaks for itself. We are proud to support this program and proud of the partnership that continue to strengthen it. We also look forward to continuing our work with local partners, the town of Plymouth, and our state and federal legislation delegation as this important effort town continues to grow. We will continue our joint advocacy in support of Massachusetts House Bill 4336 and hope the legislature passes this important initiative in the very near future. I'd like to also mention and extend my many thanks to the entire staff of Dr. Trecarton, his exceptional care which provides for patients, the beginning of treatment through discharge, through your dedication, compassion, and professionalism truly makes a difference. Thank you so much for being here this morning. I look forward to hearing more of these direct leading this important work and excited about the future of the county programs. Thank you so much. Oh yes, I'm sorry. I'd next like to introduce Chris DeBona from Brewster Ambulance. Thank you. Chris?
Thank you, Sam. Good to see you. Good morning, everyone. Thank you for coming today. My name is Chris DeBona. I'm the Chief Clinical Officer for Brewster Ambulance Service. I am accompanied by a group of physicians, nurses, and specially trained paramedics that are delivering mobile integrated health to the community. There is a little bit of history with mobile integrated health. It's been around since 2014 in the Commonwealth, but we're very fortunate to expand in the Plymouth County area during COVID. So this has been a multi-year program that we've had with the community and with the Beth Israel Deaconess Plymouth. There are three key factors that bring in a good mobile integrated health program. We need the right patient, a hospital identification, and the home health delivery by experienced paramedics. And we really found a great niche with the Beth Israel Deaconess Plymouth, their leadership team, as well as their mid-levels and nurses that are working in the facility. These are exciting times. We're able to treat folks in their home, bring cardiac monitors, point-of-care testing, advanced pharmacology, and this is going to bring us into the next layer of home health and bringing paramedics to the community. We're very fortunate at Brewster Ambulance that we're able to provide the 911 service for the town of Plymouth, also the interfacility transfers for the Beth Israel Deaconess Plymouth, and now introducing the mobile integrated health to the community. Thank you for coming, and I'd like to introduce, sorry, it's on the last page, Mrs. Jutras and her daughter Janice, who have experienced our program. They'd like to say a few words. Thank you.
Hello everybody. I'm really happy to be here. I thank you for allowing us to do this. I'm so excited about this program. I think it's the best thing anybody ever thought of. They have helped me immensely. They've been able to come to my home whenever I needed them to. They've done laboratory tests. I have had a UTI and I've had intravenous and to receive fluids because I was dehydrated. And they check my blood, which is really important. I need that done all the time, every week, all the time. One of the times that I had them come, the paramedic came in. He's retired now. I wish he hadn't, but he did. Everybody has a life. Anyway, as soon as he came through the front door, he took one look at me and he called 911. That was the night that I got a helicopter ride to Boston. My blood had dropped so much, and there was no way to know it without that test. He didn't bother testing me, he just had me go to the emergency room. And I don't know what he told them, but there was a whole team of doctors and nurses and technologists all right there waiting for me. I didn't have to wait for anything. I just think this is the greatest thing that could ever happen to anybody if you're sick, especially older people who really, if you're alone. I have my daughter with me all the time, she's right there, but a lot of people are alone and they're old and they're scared and they don't know what's going on and they're impatient, and I think this is something that it helps them. If they can have somebody come to their house, it's like back in the day when I was young and doctors made house calls. And they don't rush you, they don't take your time, and when they come, they give you a lot of advice on what you're eating, what you're drinking. I never realized how much fluids I was taking in until they told me about soup and milk and tea and coffee. That's all part of it. I was just drinking as much water as I could on top of everything else. So I'm really happy about this program. I hope you keep it up forever. And I hope more people learn about it. I tell everybody about it no matter where I go. Thank you very much for this chance.
And I just want to say thank you so much from the bottom of my heart for saving my mom's life, because they really did. Thank you.
So at this point, that concludes the event. I don't know if anybody has any questions. Everybody will be here and remain available to answer anything the press may have about this vital program servicing Plymouth County. So thank you all very, very much for being here. We appreciate it.